Hi, my name is Jen, and I wanted to talk about virtual EMDR and what it's done for me. So, first of all, I would classify myself as a self-healer, but I have been in and seen therapists for probably almost about 15 years at this point. I started in college, had some different therapy with my first marriage, and then in my second marriage, went down a really intense path as my partner went through several diagnoses, from ADHD to bipolar to borderline personality disorder. And throughout all of this, I began to notice things about myself and, unfortunately, some of the gaps and the holes in traditional talk therapy, where I began to search for different tools. Talk therapy is great. It taught me a lot of amazing things, especially how to communicate, how to dig deeper, how to accept the fact that I had experienced trauma as a child. And I was really getting stuck with some specific traumatic events, that these are the things that like you have flashbacks of, or maybe they're the things that have given you some triggers. So explosive behavior from a relationship, being uprooted out of my home, these kind of like really intense emotional experiences that just my brain wouldn't let go of them. And I'll give you a little explanation from my understanding and what I've experienced in my body using Virtual EMDR, which is an online program. So I was working with a therapist. She's a trauma focused yoga therapist, also has her master's in therapy. And I started telling her I was using this, and she was really excited about it. And again, if you've never done it or you've never been to therapy, I think this is an intense modality to use on your own. But if you've been healing and you're looking for some real relief from trauma, from events that you can't like get out of your goddamn brain, then I would recommend this time and time again. I actually have recommended this program to a lot of people that I know. And I have noticed within 1, 2, 3 sessions that there's not a way to explain it, but like it's like when you've experienced trauma and you have some PTSD or anxiety or depression about it, this softens everything. Like immediately. The next day after I've done a session, it's like I can feel something in my brain. It's different, it's fresher, it's newer. I don't have these beliefs that are just like concretely in the synapses in my brain. And I've been able to let go of some serious traumatic events. I'm actually now regressing all the way back to my childhood. I've used it to work through traumatic events in abusive relationships. I've used it for grief in letting go of, I had stepchildren, and now I don't because they weren't my biological children. I'm not in that relationship anymore. And I had a huge hole of grief that I didn't know what to do with that, and was having a lot of flashbacks of being a mom and all of these things. And so I've used it for grief, and I'm going to continue to regress and work on some of the traumatic events from my childhood, which partly is also my own self-healing work, where I've identified these memories and these moments where I know that my body and my brain decided to create a story in here. So I can't speak highly enough of virtual EMDR. I was talking to my friend the other day who also is going through a pretty intense healing process, and she explained to me that if we are trees, branches are addiction, which if you've heard any of my other Instagram videos, I talk a lot about how addiction and how we all are chasing external happiness. That's an addiction. So the branches are an addiction. And if we cut off the branches, the tree trunk is still there, the ground is still there, and the roots are there. And the tree trunk is going to be, and the ground is like depression and anxiety and PTSD. And then below the surface into the roots is trauma. So to really get rid of like the addictive behavior, the anxiety and depression and PTSD symptoms, we need to go deep into the roots of our trauma and heal those. So I think, and the roots, so there's several things that can help heal the trauma, one of which is EMDR, one of which is finding empathic support. So that's rallying people around you who can create safe space to hear you process. There's like exercise, and obviously diet and sleep, stress relief, and a couple other things that actually like help to physically, like heal this trauma.